With a mysterious illness in kids that doctors think is linked to COVID-19. Tonight, Oregon may have its first case. Dozens of children have been hospitalized, even killed by the sickness in hard-hit New York State, where the governor just issued this warning to parents.
Well, children aren't affected. Oh, really? That's another fact that they're going to change on us. Now we're worrying about we have 93 cases that we're investigating of young children who have COVID-related diseases.
Now those fears have come to at least one local emergency room. Fox 12's Camilla Ortiz joins us live with what parents need to know. Camilla?
Well, Pete, the chief medical officer at Randall Children's Hospital in North Portland said a patient showing symptoms consistent with this inflammatory reaction was admitted just in the last couple of days. An infectious disease expert told me this syndrome is very, very rare, but it can be serious. And Pete, like you mentioned, in a very small percentage of cases can be fatal. COVID-19 is throwing us another curveball. An inflammatory illness that can develop in kids weeks or even a month after exposure to the novel coronavirus.
It appears to be a response that follows an active viral infection. We think it is linked to COVID-19.
OHSU pediatric infectious disease expert Dr. Don Nolt told me PIMS, pediatric inflammatory multisystem syndrome, can happen after a child has finished fighting off a viral infection.
The immune response may get a little confused and start looking for other things to protect against, and it starts looking at the body's own tissue.
That causes symptoms like persistent fever, rash, and swollen hands and feet, and if it's not caught early enough, can start harming organs. About 100 cases of the syndrome have been reported in the U.S., many of them also testing positive for COVID-19 or COVID antibodies. Randall Children's in Portland is looking into a potential case.
What we have seen here is a patient was really tired, with red eyes, very weak, and that was due to low blood pressure.
Dr. Ofer Nadler is the medical director of Randall's ER. He said they're still monitoring the patient and don't know for sure if it's PIMS or something else.
We'll see in the next few days what happens with this case. There are so many other illnesses that can look the same, and we're trying to figure this out.
Nolt says not every PIMS case requires hospitalization, and outcomes are usually good.
If things are feeling very serious or very uncomfortable, go ahead and seek medical care.
And PIMS is not contagious. Nolt stressing again that this is very, very rare. More research on how it relates to COVID-19 still needs to be done, but Nolt said studies have shown anti-inflammatories administered in the hospital have helped. Reporting live in Beaverton, Camilla Ortiz, Fox 12 Oregon.